The psychological trainings programs used to be called CYPPT, Improving Access to Psychological Therapy, and that's what they were. They've been going for about over a decade now that we've been involved in this project. It's an NHS England project that was designed to restructure or transform services for young people. It's a national project. It's run as a collaboration with other universities around England. And Northumbria are our other big partner in the northeast of England. We're involved at Northumbria University in national curriculum writing, so we're at the forefront of making sure that what we're training these professionals to do is evidence-based and is needs-led. The most dominant therapy is cognitive behavioural therapy, which has the biggest evidence base. We also teach systemic family therapy. In the past, we've taught interpersonal therapy. But our greatest, the biggest initiative nationally and actually internationally is what we call low-intensity cognitive behavioural therapy.
We have a range of courses, from entry courses for people who are new into the profession, who might have come from different disciplines. They might have come from education, they might have come from social work or youth work, or been involved within mental health but in a different role. So we have some entry-level programmes that kind of bring people into the workforce. And alongside that, we then have other programmes which are there to develop existing staff, either to upskill them in the area they're already in, or for people who might be moving into a slightly different field, but within that children, young people's psychological trainings kind of suite. So for people who are new to working in a mental health profession, we have the children's wellbeing practitioner and the education mental health practitioner, who do similar low-intensity roles, but they work in very different contexts. So we have EMHPs who are working within schools, colleges, and we have the CWPs who are working within community areas. So they would be for people who would be new into children's mental health as a career. For people who are wanting to develop their skills, who are already working within the sector, we would have something like the senior wellbeing practitioner, which kind of takes that low-intensity practice that people have been skilled in, had some years worth of experience in, but then takes it to a different level and gives them a wider range of options of support they can do for children and young people. Alongside that, people may want to develop their career in terms of supervising others. So the supervision programme equips people to then become effective supervisors within their field. There are other options for more high intensity work, so for people who might want a slightly different career pathway, who might want to work within high intensity CBT or within systemic family practice, they would be options for people to kind of take a different route within mental health, but who are already established within the profession. For staff and leadership who are working within the sector, we also offer our transformational leadership programme, which gives those staff in those kind of strategic lead roles the opportunity to sit back and really reflect about how their teams are working, how they want their teams to develop, and really think about, I suppose, future-proofing teams to meet some of the challenges which may come across them within the kind of next couple of years, to develop their skills, to keep their teams happy, together and effective.
You've got an increasing amount of young people that need to be supported, that have mental health difficulties. You've got services that are under strain and unable to do that effectively. And this programme came out of that need, the fact that we didn't have enough data to show whether young people were getting better. Young people were spending long periods of time under the care of mental health services, and so this initiative and the way that it continues to grow is very needs-led. It's based on children's needs, young people's needs, parents' needs, families' needs.
We know that children's mental health and well-being is continuing to be an issue. We know that children are continuing to face challenges in school, home, accessing the internet, navigating the world that they're living in. So it's absolutely paramount that we have a workforce who are equipped, who are confident and competent to go and support those children, having that multi-professional approach so that they see themselves as being one factor in supporting those children, young people and their families in navigating through what for those individuals is often a really difficult period of their lives. It's incredibly needed, it's incredibly worthwhile, and to be part of something which is having a direct impact on children and young people. You know, what better career to have?
So these programs are postgraduate primarily, but we have a very clear agenda about widening access. Traditionally, our trainees might come from, for instance, like I say, they might be a qualified nurse, a social worker, psychiatrist, psychologist. But as well as that, we've identified gaps in the market. For instance, Northumbria University have been involved in a large national piece of research which has identified that males are a protected characteristic within this psychological profession training, and that South Asian males in particular. So we're looking at making sure that our programs are accessible to individuals of different economic backgrounds, different cultural and ethnic and racial and religious backgrounds as well. So one of the programs that we're really proud of is that we have started to train parent carer peer support workers. That means that we're training parents to support other parents within the protections and infrastructure of the NHS. Another program that we're very proud of is our enhanced evidence-based practice, which allows access at a lower academic qualification so they can progress into the programs with us at Northumbria. This allows us to access individuals that might not have had formal undergraduate training, and allows us to appreciate some of the practice that they've earned in the University of Life, if you like. So it's a very clear agenda of us to make sure that, as well as our postgraduate individuals that will already have level 6, 7 and 8 qualifications, we're also looking at individuals that might have come through different routes. Northumbria have been at the forefront of the children and young people psychological trainings for over a decade. We're one of the most highly respected universities, and we also have that compassionate edge. People that come here enjoy being here, and they come out the other side as effective, safe and competent psychological practitioners out there working with vulnerable kiddies.
So Northumbria University is incredibly forward-thinking, and because it's forward-thinking and because it is very much focused on having a wider societal focus in its research, in its teaching, children's mental health and psychological trainings fits really nicely into that kind of big vision that the university has for wanting to support and change society.
The University in Northumbria is one of a small number of higher education institutes who offer this suite of programmes. We have strong relationships with local and national teams. We aim to have a mental health support team in every school in the next 5 years, so it's a growing industry. The team at the University in Northumbria have developed a really strong community of practice. That means within our teaching we rely on expert support from associate lecturers and specialists in their field, which enable our trainees to get up-to-date current practice from existing practitioners. So University of Northumbria is the place to be for children and young people's mental health.